I'm Mike Albertson. I'm the Deputy Director here at the Center for Global Security Research at Lawrence Livermore National Laboratory. Today we're going to hear from Dr. Gigi Gronvall, who is a senior scholar at the Johns Hopkins Center for Health Security and an associate professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Her CGSR lecture this morning is titled Learning the Right COVID Lessons for Public Health Strategy. Not a topic that should require a great deal of explanation, given Lawrence Livermore's contributions to the broader effort dealing with COVID-19. But I did want to highlight a little bit what we've done here at the center on the COVID-19 topic. We had Dr. Brandy Van give a CGSR talk back in June of this year from the DoD perspective to touch on COVID-19. And Richard Fontaine gave a talk in late 2020 which was on the global security implications of the COVID-19 pandemic. So both of those talks are up on the CGSR website if people want to go back and look a little bit at what we've done. But I think we're at a point now where the proper amount of time has passed that we can start looking at lessons learned, both to try to remember them for next time, but also to try and build a sustained program that will be up and running the next crisis we face, so we don't have to necessarily relearn and rebuild, as is so often the case, not just in biosecurity, but sort of when you deal with any type of crisis. So we're very lucky to have Dr. Gronvall with us today to talk about this topic. As I said, she's at Johns Hopkins. She's an immunologist by training. During the COVID-19 pandemic, she's led the center's ongoing efforts to track the development and marketing of molecular and antigen tests and serology tests, as well as the development of national strategies for COVID-19 antibody tests and SARS-CoV-2 serosurveys in the United States. She's written extensively about the scientific response to the COVID-19 pandemic, the contested origins of SARS-CoV-2, and the implications for national and international security. She's the author of a couple of books. One is Synthetic Biology, Safety, Security, and Promise, where she describes what can be done to minimize the technical and social risks and maximize the benefits of synthetic biology, focusing on biosecurity, biosafety, ethics, and U.S. national competitiveness, which are important sectors of national security, important sectors for the lab as we think through sort of technology competition. She's also the author of Preparing for Bioterrorism, the Alfred P. Sloan Foundation's Leadership in Biosecurity. Just for the group, as a reminder, Dr. Gronvall is going to deliver her remarks for about 45 minutes, at which point we'll open the floor up to discussion. Please feel free at any time to raise your hand electronically or submit your questions in the chat function, and this way we can get the discussion rolling very, very quickly as soon as her remarks conclude and try to get as many of your questions and comments as possible in the time allotted. Gigi, thank you again for being with us. Over to you, and very, very much look forward to your presentation today.
Thank you so much. It's really a pleasure to be here. I wish I was here in person. I visited a few years ago and it was just a great experience. Maybe some other time. I'm just looking for my slides here, which are here somewhere. Here that is. Okay, and I put this into presentation mode. I assume everybody can see it?
Yes.
Thank you. Okay, so thank you for the introduction. A lot of those things that were mentioned are the topics that I'm going to go over today. I have always been a person who goes well under time until I started teaching, and now I find that I need to check to make sure that I don't go over time. So I will do that on occasion. So please, when the 45 minutes is up, I'm happy to end so we can have a conversation afterwards. So as was just mentioned, the pandemic is not over, of course, but we are at a point where we can evaluate what lessons there are to be learned. We can write down what actually happened and try to resist the tendencies of groups and individuals to rewrite the history of what happened in COVID. And so try to begin the process of adjusting our responses, our planning, so that we don't have the same situation happen this way again. Mistakes are always going to be made, but if we could try to avoid the ones we made this time, that would be, of course, our goal. One of the successes, though, of COVID undoubtedly has been the science, has been the research. It's really truly astounding that we have had so many vaccines that have been successfully launched, that have saved so many lives. And it's not just vaccines, but that's the most obvious scientific product that has changed lives over this pandemic. It really is not just a testament to the vaccine companies, but all the work that has gone on for years and years that has led to this point in this and related fields. We have had for a long time, as you remember, there was the only research that was ongoing was research on COVID. Scientists really contributed and built an amazing body of literature about this virus. And we have learned, even though there's much to learn about the clinical effects, especially as we think about long-term effects of the virus. But I mean, it's truly astounding how much we have learned in such a short period of time. I teach a class on 1918 flu, and I started teaching it actually before the pandemic, and part of one of the lessons that the students learn is how, you know, we think of it, oh, that was 100 years ago. What were they doing? They were just like banging rocks together at that point. But the reality is, of course, that there's some pretty amazing science that was going on at that time. And it was, you know, the golden age of microbiology was years before. There were diseases that were treatable, that were not treatable decades in the past. It was, you know, a good time for scientific discovery, but just the limits of capabilities, viruses were just out of range, and so it's astounding now to think about how long it took from the waves of influenza that swept the globe to when it was conclusively determined that it was an influenza virus that caused that. And then to how many years later a vaccine was developed. And so 14 years between the beginning of the pandemic and when the cause was identified. And so that was 100 plus years ago. And we've gotten that down to days to weeks for this pandemic. Even more recently, I was looking at, this was an article that we wrote in response to SARS and some of the biosafety concerns that arose during that time. And some of the lessons that were learned from SARS is that, one, we needed to get much better at sample sharing because samples are really scarce. It was really hard to do research on the virus, and samples were baking on tarmac, and because the export control paperwork wasn't filled out correctly and things like that. So sample collection and sharing is still an issue today. And you do need samples, but the ability to share information over the internet and being able to study the virus that way really changed the game, and that is a much more recent development. And just you don't need to go back 100 years to see the pace and progress of science. And another big development was that was a hindrance during SARS was that people they were doing research and then they kind of sat on it while they were doing their experiments and writing it up until a journal could publish it. And the advent of preprint servers, there are problems, of course, but just the ability to share information much more quickly really was another game changer for COVID as opposed to SARS. So those are some pluses. So what I want to think about is, what are in 100 years, what I hope will happen is that, some people there will be some disease emergency, or maybe in some class when somebody's teaching a class on COVID-19, and the students will be like, oh, you know, they did their best with the tools that they had available, but you know, they really had no idea how to control diseases the way we do, or they had no idea what these viruses were like we do now. So I really hope that we seem like as far distant and so at the beginning of our discovery as people think of the scientists 100 years ago. So trying our best, but still there's a lot to learn. Because as we all know, SARS-CoV-2 will not be the last infectious disease threat we face. There are lots of contenders for future pandemics and disease emergencies, and I found this slide and created it prior to the monkeypox challenges we've had of late, and of course now the CDC just today issued a bulletin to U.S. physicians to be on the lookout for suspected Ebola cases. So we know that we are going to be dealing with multiple disease emergencies at once, and there's going to be lots of different challenges, and we do need to get better at them to prevent situations like this. I don't know if people had a chance to see this art installation at the Capitol. This is about a year ago, where the flags represent deaths from COVID. So as was in my introduction, I have spent a lot of time in the last few years talking about testing. So I want to talk about some of those challenges, just to refresh your memory. Early on in the COVID pandemic, we didn't have tests. There was a big failure of the CDC to be able to create a test. The private sector was not brought in. Eventually, people had COVID, recovered, and never got tested to see if that was what it was. And then that led to the drive for serology tests. And you know, serology tests were mentioned bunches of times at the White House, and the former President Trump talked about them often. And the whole idea was that, you know, if you could measure your antibodies to COVID, then maybe we could. There was an idea floated to have immunity passports. So if you've had it, then maybe you don't need to abide by any restrictions. Serology tests were not easily available either, and so the FDA kind of opened a lot of the spigots to make them available, which led to really rampant fraud of companies just flooding the market with tests that did not work, and many of them that would give you just about as accurate a result as if you flipped a coin. And so some of those tests were taken off the market, and more strict measures were put into place. PCR then became much more available, and we also had the advent of rapid antigen tests, and everybody's familiar with taking lots of those. But that was a more recent development in 2021. So we started early on tracking some of the characteristics of the tests, especially the fraudulent serology tests, and just getting more into the issues when people start talking about the potential for immunity passports. And there are lots of problems with the idea of having an immunity passport. First of all, you're kind of incentivizing the getting of the contracting of COVID. But besides that, there would be a lot of problems in being it wouldn't have worked just because of the nature of the virus. But we started keeping this list of what the tests were like, what sort of validation criteria they had, what kind of tests were available, what information was available. And we ended up getting funding from Lyda Hill Philanthropies and the Gordon and Betty Moore Foundation to create a website to provide this information. and we still maintain it to give information about the basics of all the different kinds of tests, what details about the tests and what their sensitivity and specificity is, that as far as we know, how they've been tested and validated. And these are all US tests that have emergency use authorization designation. We didn't track the many more types of tests that are available in Europe. And testing services. So a lot of companies, there are some companies that provided testing services, like for example, Concentric by Ginkgo. They did the testing for where I live in Baltimore. They did the testing for the Baltimore City Public School System. So you could learn about all the different kinds of testing services. And we had webinars about different different businesses and industries and how they use testing. We did everything from travel in school, a couple of webinars about schools and how they implemented testing. One of the cooler ones was from the entertainment industry. I happen to know an executive producer from The Flight Attendant on HBO, and so that whole series, the first season, was filmed during COVID without vaccines available. So, so they had they used testing to keep everybody safe, and we tried to document what happened was as far as the testing strategy, all to try to, think ahead and what we need to have available for diagnostic testing in a future disease emergency. And right now we are working on a project interviewing a lot of the people who are involved in the testing companies, so the big, LabCorp, Quest, and as well as government officials and the various parts of HHS that were handling testing, to see, what kinds of things need to be maintained to be able to more rapidly provide tests to people. I think just in general, even in 2009 with the H1N1 pandemic, flu pandemic, testing was just not a big deal. I mean, it was assumed if you got sick, you had the flu, that was bad, but that was the end of it. You didn't necessarily need to have a test. I think we are now in a different time, and a definitive diagnosis has value. It always had value, but now that the technology is there and the expectation is certainly there. So this is just the reality of where we are. People have this expectation, and also, it can be used to control disease, and we didn't use it that well for that purpose in this country, but individuals used it for that purpose and had success with it. So besides testing, there's other medical countermeasures, and we all know about the incredible success of the organization formerly known as Operation Warp Speed. I don't know I can't remember what it's called right now, but developing the vaccines is amazing. This is not the mechanism that was supposed to be in place to develop this. We had such a thing as the Public Health Emergency Medical Countermeasures Enterprise, or FEMC. This is the mechanism that the coordinating body that is supposed to develop medical countermeasures and to put things into the stockpile, into the Strategic National Stockpile. This is a National Academies report I co-chaired with Ellen Leshner to basically figure out what happened to FEMC and how it can be reinvigorated for the future. It was kind of dismantled in lots of different ways over the previous administration, and it was taken to just focus on a couple of diseases. It was made into much more of a top-down organization, and none of the Strategic National Stockpile reviews were done in the previous administration. So it's a matter of rebuilding this mechanism to be able to plan for not just biological threats, but the range of medical countermeasures that might be needed that are not going to be delivered by the marketplace. Some of the major recommendations, happy to talk more about it, but the major recommendations are to reaffirm the mandate that this organization has. And something I think is very important is to develop an advisory committee that includes non-federal and private sector partners as stakeholders. So this mechanism was government only, and so a lot of people really didn't know about it, and they certainly didn't know how much it changed over the last several years. And so the hope would be that an advisory committee would make it more effective, and also that transparency would be helpful. The U.S. can't prepare, as you know, for every single threat. And so having an advisory body to guide the direction that the U.S. government takes to prepare for threats can be beneficial. It also would be good for the people, for the stakeholders to be part of this committee. Some of the big failures during COVID, so the Strategic National Stockpile was opened, stuff was sent, hospitals received ventilators. They didn't know that they had the capability of receiving, and it wasn't the type of ventilator that they knew how to handle. So like you had stuff that was being sent that they were not trained on how to use, and there's really no reason why that has to be. People should know what might be coming their way in the event of an emergency. There was some pushback there that apparently some people thought that this information should be closely held or classified. A lot of the FEMC meetings were held in a SCIF. But, you know, you can't run a public health emergency response from SCIF. You need to be able to know what you have to prepare, and you have to exercise that capability. And so I think there is an opportunity for FEMC to be more effective in a future disease emergency if changes are made. So mention the COVID origins. This has been a major hot topic for years and years, it seems, but only, of course, since 2019. This is open access. I go into a lot more detail. I'm just going to kind of skim over some of the major points on this paper. This is a policy paper, so it doesn't require a scientific background. More recently, there have been some very extensive papers in Science that go into a lot more detail about why SARS-CoV-2 is almost certainly a naturally emerging pathogen that emerged, that started infecting people at a particular market from infected animals. So there's more scientific stuff. This is more on trying to explain to non-scientists why the evidence points that way. One of the points I make is that, you know, we have to, one of the people who are strongly believe that the virus came from a laboratory point to the behavior of the Chinese government over the course of the pandemic as less than transparent, redirecting where the virus may have come from as evidence of guilt. And I tried to make the point that we should really be careful not to mirror image, to expect that the Chinese government would act in a way that we would expect them to act if it was the U.S. government. So it's important to look at the evidence and not assume that behavior is necessarily reflective of obscuring a lab leak. One of the, I think, really sad parts of the investigation in the origins was that the World Health Organization was not allowed to continue the path that they were on to send teams to China and to look for the evidence, whatever there was, for how the pandemic started. The report that they issued from their first and only meeting was a couple hundred pages. I recommend it. It was good. There was a lot of great detail in there, but all the focus in the press was on the last page where they said that it was very unlikely it was a laboratory leak, and none of the detail inside. It's Chatham House rules, but I was in a meeting with somebody who is a strong proponent of the lab leak theory, and that person never read this report, which is unfortunate because there's a lot of information on there, and the combination of science and diplomacy is really important in these kinds of investigations. So anyway, I was reading the report when it came out, and it was just, interesting information, lots of details about samples that were collected, hospital statistics, et cetera, et cetera. And I got to page 98, and I read this paragraph. And this is the paragraph that really stuck out to me as like, wow, this is complete baloney, where they say the market authorities have confirmed that all the reported live animals sold in the market were from farms that were licensed, and there was no illegal trade. There's nothing, even though there was some photographic evidence that live animals were sold at this market in the past years before, there have been no verified reports of live animals being sold at the time when the pandemic erupted. And I read that and I said, good grief, if the mayor of Baltimore had said that there was no illegal activity that was going on in the market, in Lexington Market, I would say that's just, untrue. Just, it's untrue. And so later on, it came out that this one paragraph was a 19-hour diplomatic standoff with the WHO team as they carefully crafted this paragraph to impart information that that there had been reports of illegal activity in the past, but that there were no reports at the current time. And it didn't take long for photographs from an unrelated scientific study to come out that that particular market had plenty of illegal animals that were sold there at the time when the pandemic started. And they were stressed, they were in crowded conditions, they were not supposed to be there, but they were. And here are a couple of pictures of the susceptible illegal animals that look in better condition. You can see how cute raccoon dogs are and how they got their name. So some of the other considerations were that people early on raised the possibility that that COVID could be a biological weapon. Some of the stuff that seemed unusual about the virus, there's a lot of talk about the furin cleavage site or the codon use. All of that seemed unusual. It turned out to not be unusual once the baseline, once more information was gathered, once enough more coronaviruses were found and sequenced. It wasn't found to be as unusual as that seemed. We have a problem of looking where the light is, as you know, and not seeing what else is out there. We still do not have the ability to accurately predict function from sequence to that level, certainly with this new virus. And my favorite example of that for non-scientists is to talk about Omicron. When Omicron first hit the news, people were like, oh, that's bad. Why was it bad? Well, it's like really different. It's really different from, the original COVID. And so, that's not good. And what could you say about the clinical impact of that? Nothing really, until you had numbers to look at. And so we do not have the we are not as good as I think non-scientists think we are at being able to predict the impact of some changes in sequence to how it acts in a person. And then of course there's the like, why would somebody release this particular virus as a biological weapon, and if it's not really a good weapon for many types of purposes. A laboratory leak, there's lots of reasons why that is unlikely, that the science papers do a much better job of going into. But there has been no virus that's like SARS-CoV-2 that has been placed in a laboratory prior to the pandemic. And the closest virus that people like to talk about is this virus called, that's referred to as RATG13. It's only got a 96.2% similarity to COVID, to SARS-CoV-2, which it's a really solid A, but that 3.8% is not one chunk. It's spread out throughout the genome. It implies a lot of years of evolution, somewhere between 10 and 20 years of evolution. So it's really not as close as it appears. And there's lots of evidence that those science papers go into about the connections to the market, the excess deaths that were really quite far from the laboratory, even if they were in the same city. There were looks like there were multiple spillover events from animals to people. And they actually found virus in the drains where the animals were butchered. So it's kind of seems pretty conclusive, and if there's more evidence, of course, then things will have to be reevaluated. But as of now, I think it would take an extraordinary amount of evidence to shake this. It's important for people to realize that, a lot of the focus on that question is taking away our attention from why was it spilling over from a market? The illegal wildlife trade there's a lot of money in it. This is a big error bar here, $18 to $74 billion worth of illegal trade in China alone, estimated. So it's really hard to know exactly how much money that is, except that both numbers are big. But the bigger number is bigger than the cattle industry in the U.S. in 2017. This is a lot of money. And that picture is of a pangolin. And I think it's like called, that's one of the potential hosts for SARS-CoV-2. And I think it's called, in parlance, like a walking avocado, which is kind of neat. Okay, so then as far as One Health goes, we're not learning the lessons from that. Everybody loves One Health. They think it's obvious that we need to be concerned about the interconnection between people, animals, plants, and their shared environment. It's super important. But we don't, public health even does not stand much of a chance when it comes to interrupting land use decisions, the deforestation, and how that affects bat populations, stressing them out, increasing the likelihood of spillover events, and in the research that is done to study this process is truly minimal. One of the striking things I found when I started getting into this is like everybody knows who these researchers are. It's a lot of focus on EcoHealth Alliance. There's just not enough people studying the potential impact of spillover. We don't do enough studies of bats in this country in our research. I think that's changing a little bit. There are definitely some bat colonies that are being set up. But when you consider all the diseases that have something to do with bats, it's kind of amazing that we don't have more of that going on. It's not just coronaviruses. We have lots of bat connections for some pretty terrible diseases. WHO has some great guidance for how food markets can increase biosecurity and reduce the likelihood of any infectious disease risk. But somebody needs to actually inspect those markets and make that happen. Laws prohibiting them probably not going to work out very well. It doesn't seem like it worked out very well in this case. There were laws on the books preventing some of these illegal animals from being sold in China, but the money involved is certainly enough to have people look the other way. Given the difficulty in attributing COVID to a source, we are working on, one of my colleagues is doing her dissertation work on this, and on how we can better attribute emerging diseases and what pieces of evidence will hold the most weight, what kinds of laboratory systems are required. I'm afraid that we will get a lot of data on this, but I think it's going to still be contentious no matter what, and conspiracy theories will abound anyway. Another issue that I think is an important lesson to be learned from COVID is, how can leaders be better informed about infectious disease risks? This is the national security strategy for the Trump administration. It was, it had, Trump characteristics, but it was not, it was not a copy and paste from the previous administration. But it was reasonable in how it treated the potential for deliberate, naturally emerging and accidental disease threats. It was totally not what was followed, and it didn't seem like people had really read it. This is soon after COVID started. There were lots of people in the political science world who were saying, maybe we need to have more public health knowledge for our security leadership. People were talking about how, there just isn't a lot of biology knowledge amongst the national security professionals. I think that this is a big problem. People should be able to ask the right questions. You would not have a national security professional who did not know what the nuclear, or you shouldn't have a national security professional who doesn't know what the nuclear triad is or have no details about the nuclear world. They should know something about disease emergencies and surveillance and things like that. I think there was a quick, oh, this is important, and now I think it's going back to business as usual, and that's something that's why we have HHS. Not unrelated to this, we have had huge challenges with scientific mis and disinformation. The whole obsession with herd immunity was tragic. For people who are not in this world, misinformation is just wrong information. Disinformation is deliberately wrong information. One of the things that I'm most proud of that we did over the course of the pandemic, there was a report that a Chinese dissident came forward claiming that China had deliberately created SARS-CoV-2, and there was this report. It was full of like pseudoscience, sort of, sciencey sounding words. It was long, it had graphs, figures, but when you read it, it was just like, oh, this is bad, this is terrible. There's like nothing made sense. There's just like lots of, restriction enzymes thrown in there, but it didn't make any sense whatsoever to a scientist. And so when this hit, and it turns out that this Chinese dissident came up with this report and was funded by Steve Bannon and an organization that was connected to Rudy Giuliani. It's clearly meant to show that it was it was China's fault. All these people in the U.S. that were dead, it was not the fault of any mismanagement of the pandemic. It was really, it's all could be laid on China's feet. And scientists who were quoted about this report, they said, this is garbage. This is total, baloney, or other words to describe that. And so we decided that it was important enough to really concentrate on giving this a peer review. And so we peer reviewed this report and came up with a few dozen reasons why it was wrong. And nobody really, nobody in the media read our report either. But it was still that's the scientist who the heart of it. It was still quoted by CNN and New York Times and all these other respectable media sources that like Johns Hopkins scholars say that this report is not accurate and there are a lot of scientific problems with it. But still, even though we kind of turned off, I think, the mainstream media response to it, the Dr. Yan was still on Tucker Carlson like 8 or 9 times after we released this. So, truth can only go so far. And there are people who have written books about the origin of COVID that are just, just asking questions, but really not giving space or time or any effort into explaining why, the most likely explanation is that this virus emerged naturally with humans making, doing their part by creating this market with illegal animals crowded together and encroaching on wild populations and all these serious problems that are not going to get addressed anytime soon. The whole challenge with misinformation, disinformation is this kind of completely changing tacks here after Russia invaded Ukraine and started spreading disinformation about the public health activities in Ukraine laboratories. That concern is one of the reasons why we called for the U.S. to destroy our samples of smallpox. There's no reason to hold on to them. But part of the way that disinformation, misinformation works is you take this kernel of truth and then you twist it and twist it and twist it into something that can then be used as a weapon. And so when possible, it's, it's unfortunate, but when possible, you need to remove those weapons. So I'm kind of at 45 minutes, but I just will say a couple of sentences about some other work. Now that the pandemic is over, of course, we are working on all these other issues that are more related to biosecurity and able to spend more time with them. Just to let you know what they are, the Tianjin biosecurity guidelines, this was an international collaboration, unusual perhaps in these times, that was us, Tianjin University, and the Inter-Academy Partnership, which, if you're not familiar, they're kind of like the organization that all national academies around the world belong to create a code of conduct for scientists related to biosecurity. So this is intended for if you have a code of conduct for scientists, that this would be the biosecurity portion of it. And it's a series of 10 principles that I think would be hard to disagree with. And we went through an extensive international process to create and to smooth out the recommendations to make sure that they were agreeable on all kinds of ways, and we've presented it to the BWC, the Biological Weapons Convention, and we're hoping that they will endorse it or receive it in some way and give their approval to it at the review conference in November. It's a little bit complicated now because of Russia's behavior in the last year. Another project that we're doing is to try to make progress on, verification is a dirty word in biosecurity, of course, but to try and make progress on the principles behind verification, and to, we use the term assurance, the degree of certainty that states parties are acting in accordance with their obligations under the Biological Weapons Convention. We try to see what people thought would, what states parties thought could make them more confident that other states parties were acting according to the obligations under the BWC. So we interviewed a lot of states parties, delegations, and you know, the bottom line really is there's a lot that can be done in this space. There's, you know, we shouldn't just give up, but there is a lot of talking past each other. And so the idea of these kinds of projects to kind of break down, well, what do people really mean by verification or assurance, can help to create some areas of common understanding. And then finally, I'm very excited that California has passed the AB 1963, which requires many researchers, mostly in the UC system, to order genes from companies that do screening. You know, all US companies, I'm pretty sure that all US companies, they should anyway, be screening anyway, so that like a random person can't order the genetic material for Ebola to their PO box using cash. But there are companies around the world that do not do screening, and so this will put a priority on companies that do and give them more of an advantage. And so we're now working on making this a national law. So just finally, there have been many times over the course of this pandemic that I thought, you know, we are not going to learn any lessons from this. And we're going to learn the wrong lessons. And just some inspiration from Senator Ransdell. He really thought that public health was a national responsibility, and he saw what a lack of attention to public health did to France's aspirations for the Panama Canal, and how that was paying attention to yellow fever, malaria really changed the course of events there for the U.S. The 1918 flu really proved his point that public health was really important. Still, nothing was done. It was a moderate, but not nearly as severe as 1918 flu epidemic that took place 10 years later, that kind of reminded Congress that, oh, wait, we meant to do something about that, and 1918 was horrible. And they passed his bill creating the National Institutes of Health. And so I am confident that, you know, we will make the progress that we can, but we are going to get other reminders in the future, and unfortunately other opportunities to rectify our mistakes and to really take these issues seriously. So thank you so much for your attention, and I really look forward to your questions. Thank you.